Insulin and glucose work hand in hand to lower our blood sugar levels. When you eat, your blood sugar levels rise, telling the beta cells in your pancreas to produce insulin. Insulin enters the bloodstream and connects to the insulin receptors. When that is done, the glucose transporters open, allowing the glucose to enter the cell and be used for energy. They have a lock and key relationship, but not everyone's body responds the same way. In type 1 diabetes, which is genetic, it is when the pancreas produces little to no insulin. In type 2 diabetes is when there is insulin resistance. When there's insulin resistance, cells don't respond to the insulin, which leads to blood sugar levels to rise. The pancreas then continues to produce more and more insulin until giving out. When it gives out, blood sugar levels continue to rise. Glucose builds up in the bloodstream instead of being absorbed by the cell to be converted into energy. When on a diabetic diet, it should be rich in nutrients and low in fat and calories. Your diet should include a wide selection of carbohydrates, fats, fiber, grains, and proteins. You have a variety of proteins. Starches such as brown rice, baked sweet potato, and oatmeal. For fats, they must be healthy, such as nuts, seeds, or avocados. Just keep them in small portions. For vegetables and fruits, load up on them. They give you carbohydrates, protein, vitamins, minerals, and fiber. Eating food that have more than one macromolecule is a healthy source that doesn't use much energy to digest. Blood sugar is the amount of sugar in your blood. A blood glucose test measures the amount of sugar, called glucose, in your system. Glucose comes from carbohydrate foods. It is the main source of energy used by the body. A normal blood sugar is less than 100 to 140 milligrams per deciliter. 200 milligrams per deciliter or higher may indicate diabetes. Finding out that you have type 2 diabetes may be overwhelming, but there are people in the medical field that can help you with your situation. A nutritionist or a dietitian can help you determine what type of meal you should take in order to reduce your blood sugar. You can go to a certified diabetic educator, a CDE, that possess knowledge on diabetes. You can also go to a clinical researcher. They can help you determine whether your device you're using to determine your blood sugar level is effective and is doing its purpose and is safe. You are not the only one in this position. There are many people that have been in your footsteps before.
Hi, I'm DJ. I'm 15, and I've had diabetes for a year and a half. When I found out I had diabetes, I felt worried because I didn't know what was going to happen. I wasn't sure if I would have to go to the hospital or had to give myself shots or anything like that.
My name is Terry Lee Moore, type 2 diabetic individual. Became type 2 diabetic after 40 or so. Got scared, but I went to a doctor and they tested me and they said, yeah, you are diabetic.
Tragically, sometimes people with diabetes ignore their condition because there's no particular pain or sign of complications. But as Marcy Stone found out, sometimes it takes an epiphany to take control.
It took Marcy Stone almost 30 years to learn how to live with diabetes.
I was in complete and utter denial. Denial so strong that you don't want to acknowledge that you're going to have to change your lifestyle and that you can't have the Pepsi that everybody's having, or you can't have the bread that everybody.
Eat healthy, exercise, get checkups, manage stress, stop smoking, and watch your alcohol. Exercising keeps your diabetes in control. Physical activity is an important component of your treatment plan. Keep it moderate.